Good afternoon, everybody. Happy Monday. Here with Josh and Paul, and an old friend I'll introduce in just a minute. Quick COVID summary. What you see since Friday, number of tests is drifting down a little bit, 50,000 over the last 3 days. We were doing closer to 200,000 some months ago. That means the worried well is a little less likely to be getting tested. That means the positivity rate of 1.3% is low, particularly low since we don't have a lot of the more random testing, for example, that which we used to do at universities. Overall, the 7-day average about 1.3, 1.4%. During the best of our times, about last August, we were at 0.8%, give a little perspective. Hospitalizations down 28. Those are very good numbers, 170, down about 2/3 over the last month or so. Again, at the very best, we were at 42 hospitalizations, again, last August. But basically, the trend lines continue in a very positive direction. 21 fatalities, a lagging indicator, sadly, but that's over 3 days. The vaccine update. Let's see. I can tell you that we've now passed 2 million first doses, which is extraordinary good news. You can see the age distribution. I think what's interesting there is, of course, 65-year-olds and 55 to 64, both at sort of close to that herd immunity number. Sort of interesting to me that 18 to 24 is a little less than the 16 to 18s. I think we pointed that out before, which suggests that the 16 to 18-year-olds maybe get a little more pressure from mom and dad. The 18 to 24-year-olds, I'm invincible, I may not have to. But look, when it comes to that age group, we're going to keep encouraging you. 12 to 15-year-olds, we're off to a good start, as you can see by this next slide. This is the first 4 days by age group. We're kind of slicing and dicing the statistics here a little bit, but you can see we got 12% of the 12 to 15-year-olds all vaccinated in the first 4 days. That's by far the highest group, even higher than the 65 to 74-year-olds. So that tells you, I think, that you're going to see that age group get vaccinated pretty quickly. These are kids, they just want to get out there and play with their soccer team, not have to worry about quarantines, not have to worry about a mask, and I don't blame them. So we're still catching up in the other age groups there as well. Okay, who else is remaining to be vaccinated? Obviously, the 0 to 11-year-old age group hasn't even had the vaccine authorized for them yet. The other groups are sort of interesting. 100% would get you to the total 100% of that age group being vaccinated. And the yellow gets you to, say, 80% of the target number. So you can see the 12 to 15, I think we're going to get to that number pretty quickly. 16 to 24, 25 to 34, those are age groups where we have a little bit of work to do still to get up to that 80% rate. And we're essentially there and beyond some, obviously, when it comes to 65 and above. So 25 and 34-year-olds, 35 to 44-year-olds, get going, get vaccinated. Drinks on us starting on Wednesday. You don't want to be the last guy still paying full freight. Same goes with municipal breakdown. To get up to 80% of the total eligible population in Bridgeport is about 62,000, Hartford 55,000, New Haven, Waterbury. Those are the cities where we still have to make an extra effort to get the vaccine to you, make it easier for you to get vaccinated, get trusted advocates to tell you how important it is. As you remember from our last few meetings, you can call. We'll bring the van right to you. We'll bring the vaccine right to your home. We're doing everything we can to make it easier for you to get vaccinated. And then the other side, Bristol, Meriden, Norwalk, Danbury, they're at pretty low numbers, a little bit more to get going, so don't slack off. Maybe drinks on us will make a little bit of difference with those younger age groups. All right, so we got a surprise from the CDC last week. Rochelle Walensky surprised everybody by saying masks would no longer be required for anybody outside, and inside it would only be required for those who were unvaccinated. So we've had a lot of questions about that, so we just thought we could dig in on that a little bit right now. First of all, masks not required outside. If you're in a big group, a crowd, I'm probably going to wear my mask a little bit longer, but it's not a mandate. You know, indoors, you've got to wear the mask. If you're unvaccinated, that's the rule. If you're vaccinated, look, if you're able to keep your distance, you're not worried about it, that's okay. Businesses, state and local governments, universities, restaurants, they're going to make up their own mind a little bit based upon what their customers are telling them, what makes them feel comfortable, what makes their employees feel comfortable. So there'll be a little bit of a patchwork, but let's face it, we think, say the owner of Stu Leonard's knows his customers better than anybody else. There are still mask requirements in some special situations, healthcare facilities, public and private transit, correctional facilities. We're going to keep the mask on in schools a little bit longer. Those young kids haven't been vaccinated in childcare. But I'd like to think that this May 19th is a big date. That's the day that we're really ending all the core mandates on businesses, except for the indoor mask for the unvaccinated. And I think it goes back exactly a year. It was a year ago that we began opening up. So it's a year later. We see that we've really reached a point where we feel a lot more confident with our economy humming again. But with our economy humming again, we got to do a better job of getting people back to work. And that's the next slide, Max. Look, our unemployment rate is trending down a little bit, but the work participation rate, meaning the percent of the eligible population that's working, is going down. We were at 70% of the eligible population was working or looking for work just 10, 15 years ago. We were at 65% or so 5 years ago or before the pandemic, and now we're at about 60%. So there are fewer people looking for work. And I think there are a variety of reasons for that and why we still have unemployment. I think, one, we have a little older population, so some of the older folks decided they didn't have to look for work. They're going to take retirement. I think a lot of women were pushed out of the workforce. Schools weren't open. Daycare was very expensive, and they didn't find it affordable for them to be able to get back to work. We're making a big difference there, I hope. As you know, Beth Bai and the team have made affordable daycare, free to everybody that can't afford it. That's starting up, July 1st. We're going to have our summer camps, summer learning camps going, no cost to anybody who can't afford it, making that easier for our kids to get back in the game, making that easier for parents, single parents, to be able to get back to work. I know there's a fair number, and then we'll get our schools open in September and make sure they're all open so you can count on that. There's also a fair number of jobs out there in manufacturing and in nursing and healthcare that do require a different level of certification and some skills. So there may be a skills mismatch there. As you know, we're providing the free certification programs to make it a lot easier for you to get those skills if you want to change jobs or where there are opportunities. I can tell you, healthcare, there are 12 or 13,000 jobs open right now. If that's of any interest to you, this is an opportunity to take advantage of that. As you know, daycare is provided. If you go to the community college, get that certificate program, free one-pass transit, so makes that easier for you. And finally, I want work to pay. I want people to have a real incentive when they go back to work to make that happen. So one, we've got a $12 minimum wage. That goes up to $13 in a few months, to make sure that you know that work is going to pay. It's worth looking for that job right now. We need you. We need you at restaurants. We need you at grocery stores. There are a lot of jobs out there. We probably have, we have 65,000 job openings right now that are undocumented or that we need filled. And we want to announce something else today, which I think is going to make a real difference. Starting on Monday, Connecticut's going to offer you a $1,000 signing bonus. You see the big athletes get a signing bonus. Why don't you get a signing bonus as well? So for those of you who have been long-term unemployed for a while, we're going to pay you $1,000 at the end of 2 months of work, give you the incentive to get back to work, make sure work is worth your while, make sure that you can afford it, make sure if you need help on transportation, a little bit of extra help on childcare, We've got the upfront money that allows you to do that. These are all things I hope they're going to make a big difference in getting people back to work. So a $1,000 signing bonus starting on Monday. And you'll be able to sign up online at the DOL site once you've got that job in place. With that, let me just introduce you to a great friend, Stu Leonard, of a store with the same name, 3 of the great grocery stores here in the state of Connecticut. Nobody knows the customers better than Stu Leonard. And Stu is thinking every day on 2 fronts. A, what do the customers want to feel comfortable going back into the store? Mask, no mask? Where is he on that? What do the employees need so they feel confident getting back into the store as well? And then, Stu, maybe you just talk for a little bit, because we ended up talking about the signing bonus and ways we get people back to work and what your experience has been. My friend Stu Leonard.
Well, thank you, Governor. Appreciate that. Thank you. First of all, that $1,000 is exciting, because I was just talking this morning. We needed a couple hundred people at Stu Leonard's just now over the summer for butchers and bakers and cashiers, all those different jobs. And this is going to be really excited. We're excited about that. And also, my dad's 91 now. He's retired. You might get him back to the store now working at Stu's. But I would say that definitely is going to help. That people need people to work right now, and that's a great incentive. We've been in Connecticut all our lives. I was born here, not far from where I'm standing in Norwalk right now, and we have stores up in Danbury, Newington. And we have a pretty good group of customers that have been coming through Stu Leonard's for years. We have, since Dr. Fauci mentioned, required masks right away. We're very quick movers, plexiglass, social distancing, cleaning, and safety was the biggest thing for our customers. And so now that you're relaxing all of these on Wednesday, we took our signs down that said, a mask is required. But as you can see already, I wanted to be out here, so hopefully you can see a few customers. Everybody's still coming in with their masks on. I'm interested to see what will happen Wednesday when the big publicity is announced. We've had a trickle of customers already coming in and saying they'd like to not wear a mask. And we asked, are they vaccinated? And they said yes, and we let them in. Haven't heard any complaints from other customers in the store. As far as our team members go, we're handling fresh food all day. I think our team members are used to wearing gloves and hats, and masks are really just part of the uniform. So about half of our team members would like to have the masks lifted, and the other half are, let's wait a little while and see what happens. So it's about a 50-50 thing right now for us. And we told our team members we're going to monitor this up until Memorial Day and just see what the reaction of our customers are, and then we'll go from there.
Hey Stu, if I'm a team member, am I incented to get vaccinated so I won't have to wear a mask at work?
Well, we don't have an incentive right now, but what we've done is made it really easy. We have one person devoted to getting our team members vaccinated at CVS, Walgreens, all the different locations. And we have almost a 90% vaccinated rate now at Stu Leonard's. So we've been really encouraging and make it really easy for our people to leave work and go get a vaccination and come back. So that's a big thing. I think you're starting to feel the vibe in the store again. We've been an essential business. I've been at this since day one. We never stopped. We've been working at Stu's. And you're starting to feel, you saw people sort of walking around with their heads down and they were nervous at the beginning of COVID. You're starting to see like the spring fever starting. It's almost like everybody's anxious to really ditch the masks, get back to their normal life. We notice barbecues are big now. Graduation parties are off the chart. Balloons are selling again. They weren't selling at all. Flowers are starting to pick up big. So, and everybody wants to get out in their yard and start planting and get color. And I feel like there's a little bit of excitement in the air right now. And I think your decision to have no masks is a good one. Starting Wednesday at Stu's, we're going to be slow and and just monitor it and make a decision based on day to day what customers are saying.
Hey, thanks, Stu. Stu's going to stick around. I think the headline is balloons are selling again. Paul, Josh, and myself.
NBC Connecticut.
Hey, Governor, can you hear me? Check 1, 2, 3. Can you hear me?
Sure.
Okay. I think my only question is, I know that when I was listening to the CRA on Friday and David Lehman, there was a talk about, May 19th was like the day that the state was going to kind of reopen. My only question is, was there at any point, any time that you guys were thinking about maybe moving the day a little bit earlier since the CDC made the decision? Was there at any point to kind of move up the date a little bit sooner?
I guess we could have done that, but look, I find generally people like a little bit of notice. They like a little planning between you and me. The CDC didn't give us any notice, but I think it gives Stu lenders and others an opportunity to figure out, what the signage is going to be. So I think Wednesday works pretty well.
News 8.
Good afternoon. Governor, you just announced a pretty good incentive for beginning on Monday with the signing bonus. And I'm wondering, with Wednesday coming and there being less and less restrictions, does that open up even more ways to get creative, which you've been, and to incentivize even further?
We'll see. Let's start and see how this $1,000 bonus works, but I think the timing is pretty good. I mean, we got the drinks on us, the restaurants are open. Stu says he's looking for hundreds of people. This is a time when people want to hire, and I want to make sure that everybody has a full incentive and make it easier for them to get back to work.
Speaking with several people over the weekend who have children under 12 years of age, and they seem to be confused still regarding mask wearing for the kids that age, and maybe a way to take what the CDC has recommended as part of what Connecticut's rules are. Can you kind of clear that up a little bit, or are you seeing the same thing where people are a little bit confused still?
Yeah, I'll start and I think hand it over to Josh. But I think at a minimum what we're saying is let's wear the masks in school a little bit longer. Let's go through the end of this school year. Most of those kids aren't vaccinated. Most of them aren't even authorized to be vaccinated. I know that makes the teachers feel a lot more comfortable as well. Josh, you want to pick up from there?
No, that's exactly right. So as the governor mentioned earlier, there's a number of settings where masks are going to continue to be required for everyone indoors, whether they're vaccinated or not, and schools and childcare are going to stay on that list. We've got a formula that's been working really well. We're almost to the end of the school year, so we're going to stay the course there with our schools.
Channel 3 Eyewitness News.
Good afternoon, everyone. If a business asks someone if they've been vaccinated or proof of vaccination, would that be violating HIPAA laws? Would businesses asking if someone is vaccinated, would that be violating any kind of privacy law?
You want to start with that, Josh?
Yeah, we're not concerned about that. Everyone has the choice not to answer the question or to go shop somewhere else, right? If that's the case, and this is not a lot different than the old no shoes, no shirt, no service adage. Vaccines are an important part of keeping people safe right now.
And one more question. I know we're basing the mask off the honor code. So let's say we see numbers going back up in a month or two. Is there a threshold percentage for rolling some restrictions back in place if we do see the numbers start to tick up again?
Yeah, we've generally focused a lot on the hospitalizations, make sure that we have capacity there. We know from a year ago that we had very good numbers, July, August, September. And then when it went up in late October, November, December. So that was what we would watch for. There may be a little bump this fall compared to last year, but if we get 80% of our people vaccinated, it won't be bad.
Thank you.
Fox 61.
Hi, Governor. There's a rally planned at the Capitol. Educators from across the state, they're calling it the Rally for Resources. Teachers are calling on you and other legislators to pass what they believe is an equitable state budget, asking for equitable taxation and funding, increased resources for mental health. What is your message to these teachers that are planning to gather outside the Capitol this afternoon?
That we have $1.1 billion, the biggest increase, I think, ever for education. I was just at the Bristol elementary schools today, asking the teachers to think really creatively about how we use that money over the next couple of years, thinking about the social and emotional catch-up that some of these kids have to do, as well as the learning catch-up, the support that we can help provide for teachers there, apprentice teachers and counselors who can be there. So I would use this opportunity to show that what we can do with this money in a really transformative way. This is a big chance to make education right.
News 12 Connecticut.
Governor, concerning the signing bonus, if my math is correct, this sounds like this will cost $10 million. Where's that money coming from, and who qualifies as long-term unemployed?
I think it comes from the CARES Act money. We've got that money in place now. That allows us to get started. We've got additional resources that are going through the legislative process, the last tranche of federal money. We'll determine what is long-term. Let's start with, say, 8 to 12 weeks.
All right, and just one more question. The Appropriations Committee today came out with their plan to spend the American Relief Plan money. One big thing that sticks out is COVID testing. You had proposed spending $240 million on testing. They came back with just $25 million. What are your thoughts on that?
Don't get too casual in saying, hoo-hoo, COVID is behind us, but there's room to negotiate. A lot of that money is, by CDC and federal dictates, got to go to testing. Some of it we have some flexibility. We were thinking about community health and the such at some of our schools, so there's room for discussion there, but don't get too casual about the testing. It's still really important.
And I'll also add, Governor, that we're a state that was doing testing within our nursing homes and taking over that responsibility. You see the COVID vans that we have previously put out through our partnership with the Department of Public Health and the National Guard. We went above and beyond on testing, and as the governor said, COVID is still here in a lot of ways. And so we will continuously have conversations with the legislature, but the number that was put forth by the administration as part of our proposal was based upon a lot of the work that the team was doing. It was based upon the facts on the ground.
Thanks, guys. And just one more question for Stu real quick. Can you clarify what the policy is for your workers? Are they now required to wear masks, or is it up to them?
Yes, we are not lifting that as far as our workers at the store. I mean, we feel we're handling food, we have to create as safe an environment as possible. I like that comment where COVID hasn't disappeared yet. So we want to make sure our customers feel safe. They're buying their food for their families here. And all our team members are required to wear masks. We haven't had any pushback at all. But we did say to them, let's wait till Memorial Day and we'll reevaluate at that time.
Fox 61, did you have a follow-up?
This is Suzanne. I'm going to ask one more question for Stu. Stu, are you saying, hey, if you don't have a vaccine, even after Memorial Day, you're going to have to keep wearing a mask at work? And is this going to sort of create two categories of sort of not the next 2 weeks, visibly masked and unvaccinated versus vaccinated workers? And how will you handle that?
Well, first of all, we hope everybody will be. President Biden said by the 4th of July, we're going to have tremendous amount of people vaccinated. We're not going to promote not wearing a mask for unvaccinated people at all. And what we're hoping is people will respect each other there's a lot of people with medical issues and so forth. I've met them in the store, and they feel comfortable if someone's wearing a mask. So especially if you're handling food, we're going to monitor it. I can't, it's a hard thing for anybody to make a decision on. My thing, just ask your friends about this, because a lot of them are, Yahoo, I want to get rid of the mask, and a lot of them are like, I'm still a little nervous about it. So I don't really want to be a leader in this area, and just say to all our team members, no more masks. I'd rather hold on as long as I can. And I've told them that Memorial Day will make a decision.
Thank you.
WTIC 1080 News.
Hi, how would the long-term unemployed access that $1,000 potential signing bonus?
DRS is going to set up a website, so you'll be able to, note when you got that job. Then we're going to track that against the unemployment claims.
And masks at schools, certainly for the rest of this school year, it sounds like. What do you foresee for, this will be a topic all summer for folks, what do you see for after Labor Day?
I think it's going to be a topic all summer for folks. I hope that they open it up to all age groups, and I hope that we get 90% of the kids vaccinated. Everybody does it voluntarily, and we can go back to school safely.
And Stu, how has the last year been for business?
No, we've been an essential business since we began, and what we found is there's a lot of new cooks that have been created, and because of COVID, a lot of people were home, and we're seeing people looking for better wines. We're seeing them look for better steaks. And one of the big questions is, how do I in the store cook this, cook that? So, I think it's been a good thing for on-premise grocery. Across the country, I've talked to many other retailers. We've created new cooks, and we're hoping that there'll be some stickiness, and we're going to have more people cooking at home post-COVID.
Waterbury Republican American.
Thanks very much. Just to follow up on this signing bonus idea, I certainly had readers calling up complaining last year that people were making more money than they were by collecting unemployment with the federal plus up. I can imagine some folks will be scratching their head and saying, what about me? So, Governor, what do you say to folks who say, why aren't I getting something?
I'd say I'm doing everything I can to get people off of unemployment, give them all the incentives they need to get work, make it easier for them to get back to work, make sure they have the financial incentives, make sure they have the child care and daycare support they need, which is open to everybody, by the way. But I think at the end of the day, it probably saves state money because we'll have less people on unemployment and more people working.
Governor, will you be issuing renewed declarations of a public health and a civil preparedness emergency before Wednesday or today even?
Yeah, Paul, do you know the schedule on that?
Yeah, the answer would be yes. And that was a big, the legislature took action to basically provide for that extension. Obviously, there's still a lot of elements is dealing with our COVID response that the state is leading on. One of the leaders across the country as it deals with vaccination, and that ability is a big part because of the emergency powers that has been granted to the administration, to the governor, by the legislature. I think a lot of people forget that these emergency powers are not by fiat; they're granted by the legislature. So that extension will be moving forward, and we will continue our response to make sure that we can make it back going.
And what is the status of the directions that the Department of Public Health was going to be providing for large outdoor gatherings, concerts, and such?
So those are still being developed, and they'll be issued by Wednesday, as previously mentioned.
Okay. And Governor, you talked a little bit earlier about towns perhaps taking action on their own in response to flare-ups. I just wanted to follow up. When you instituted the alert system last October, initially you were going to give authority to towns and cities that exceeded a certain threshold in terms of cases per 100,000 to reimpose stricter rules that had been in place during the previous reopening stage. Are you going to be providing towns and cities any kind of flexibility to impose orders of their own if there is a flare-up in their borders?
I don't think so. We've generally found that when you have to get stricter, it's easier to do that on a broader basis. Although you remember back when we had flare-ups in places like Danbury, we did bring in a lot of extra testing and then eventually a vaccine so we could do that. Right now, we're sort of in a different place. We've got a broad, very loose set of rules starting on May 19th. Loose unless you're unvaccinated, then you've got to wear the mask. And stores and restaurants will come up their own particular rules as it addresses their customers, employees, store by store.
Don't you think that's going to be a source of some tension? I mean, you talk about different rules. I mean, if I go to Stu Leonard's and if I go to another of his competitors, I have to wear a mask one place, I don't have to another.
Look, we're following A, the CDC guidelines, and B, I think Stu Leonard knows his customers better than anybody. So he's the one that would say, this is a set of rules that makes my customers feel most confident and comfortable so they'll come in and be able to buy that steak and wine.
Okay, thank you very much.
And it is different in every store, too. Like down toward New York, what we noticed, they still are really, I think it's such an urban area in our Yonkers store that they're really, everybody wants to wear a mask down there. And I was in Dallas and no one's wearing a mask. And I think we're finding the same thing among each of our stores. It's a little different. So we have to just take the temperature and really play this one.
The Day of New London.
Hi, everyone. Governor, is there any kind of punishment for unvaccinated people who don't wear masks inside in public places? Or is there going to be? I know the state isn't requiring proof or, investigating anyone, but are there any sort of symbolic fines or anything along those lines?
Not yet. I think at this point, Sten, store owners would ask people to leave if they say, I'm not vaccinated and I refuse to wear a mask. That contradicts our rules and CDC rules. I hope that's enough.
Okay. Is there any circumstance in which you would institute those, maybe those $100 fines like back in September last year?
I think if people were purposely defiant and making life complicated for the Stu Leonards of this world, yes, I think we would institute a fine then. I hope that doesn't happen.
Thank you.
The Connecticut Mirror.
Governor, many states eliminated the requirement that people search for work to get unemployment during the pandemic. What is the status in Connecticut right now on the requirement to search?
I believe we're going to require that you demonstrate you've been searching for work starting, I believe it's June 1st.
All right. And you indicated 8 to 12 weeks you're looking at for long-term unemployed. Is that the actual policy decision, or is that just sort of what you're spitballing at this point?
No, we're going to set out those rules clearly, within 24 hours so that you know what it is. But it's not for somebody that just changed jobs a week ago and is about to go back. It's for, we have the majority of our people have been long-term unemployed, the vast majority, going back to the early days of COVID. A lot of them maybe have gotten discouraged. A lot of them are scared given COVID. A lot of them just aren't in the workforce right now. We want them to, take this opportunity to get back in the game.
And Governor, as far as the oversight bill that was passed recently, they've left open the permanent changes, that there's going to be a commission to look at it. But there are some requirements that were put in, at least temporarily, if you do future extensions under the COVID pandemic. Do those strike you as sort of a reasonable starting point for permanent changes, and how you or any other governor declares public health or civil preparedness emergencies?
Yeah, I think it does seem pretty reasonable, Paz. I appreciate they've extended the emergency authorization, into July. You know what that means if we have variants or have to do boosters and things like that. And yet they have a committee that can override any particular EO if they want after that fact. So we have a good, fair checks and balances. I salute the legislature for the proposal they came up with.
Thank you, Governor.
CT News Junkie.
Thanks, Max. This is probably a Paul question, but do we have a working number of how many executive orders we're sort of down to now? I think before we had an estimate of about 80. I don't know if that's dropped or where we're at now.
I unfortunately couldn't hear you, Hugh.
It's about 80, Hugh. We've cut it down to
80.
that, and they're all specific to, health.
Okay, I was wondering if you guys could sort of enumerate the ones that you believe will probably continue beyond May 19th. For instance, we had a reader question regarding an EO involving virtual public meetings. Do you anticipate that that will continue?
I'll let Paul speak to virtual public meetings. I can tell you what's really important to me is, let's say we start bringing the mobile vaccination van. We want to go into a parking lot. We want to do it at a school so we can find a lot of those kids, now while it's easier to do. I think those are the type of flexibilities we need.
Yeah, and I'll also add to your question, Hugh, and to what the governor stated. We're also focused on making EOs that are necessary, that we've seen are important, to be permanent. As you probably know, based upon that question, that under state law, before the EOs, you weren't able to really have public meetings, even for nonprofits, to be able to do their business. I think many nonprofits and others are seeing the importance of being able to do these virtual meetings for their overall productivity. So the governor has always stated that with the legislature in, this is a great opportunity to put forth and codify many of these executive orders into permanent law. And we have a few weeks left in session, and I know that there are some that are out there, and we really feel that they should be moving forward.
Okay. And on the signing bonus program, do we have an estimate of, I figure it's hard to tell, but like a working estimate of how much that'll cost, how expensive that'll be?
Probably $10 million.
Okay. All right. Thank you, everybody.
The Associated Press.
Thanks, Max. Good afternoon, everyone. To follow up on the question about the signing bonus, is that you would have to have a full-time job in order to get it?
That's correct, Sue.
Okay. And what was the thinking behind the bonus? Were you hearing a lot from employers that can't find employees? And also, did you give any thought to ending the $300 federal unemployment program like what we're seeing in other states?
Yeah, I didn't think about that. It ends by itself in about 4 months. It's down from 600 during the peak of the pandemic. And there are a lot of people who are just still really scared about getting back to work or have some conditions that sort of limit that for a little bit longer. So I thought it was fair that we keep that in place. But that said, I wanted to do everything I could to incent people to get back to work, make it easier for them to be able to get back to work. If it's childcare, if it's transportation, if it's clothing, maybe the $1,000 helps and makes it a little easier for them to get back in the game.
And today, the Appropriations Committee, besides cutting back the funding for testing, they actually added about $105 million over 3 years to skilled nursing facilities. And I know that you've said that perhaps maybe we should wait a bit to see what the future of elder care looks like. What are your thoughts of committing that kind of money at this point?
I think it's premature, Sue. We just put together a $300 million deal with the nursing homes and the workers. I think it makes sense on both fronts. In there is a big true-up of 10% over the next 9 months as we're going to have a better idea of what the future of the nursing homes looks like. Do people want to get back? Are they going to get back to 90% capacity? Or will things change post-COVID? I think we are going to learn a lot in the next 9 months. Let's not overcommit now.
Okay, great. Thank you.
Hearst, Connecticut Media.
Thanks, Max. I had a question for Mr. Leonard. He's multitasking over there, though. Mr. Leonard, the argument over bringing people back to work and people, some business owners saying that employees are staying home because they're making more lounging around watching TV. Do you accept that argument?
Well, I wouldn't say lounging around watching TV. I know that there's a lot of people that would not rather work and collect money right now, and that's what I'm hearing from our suppliers, and that's one reason all weekend everybody was talking about food inflation right now, and talking to them, they can't get enough workers right now for whatever reason. They can't get enough workers now. A lot of them have mentioned to me that it has to do with the amount they can get for not working. It's a real thing. I mean, this is real people, American farmers, American fishermen, American businesses, family-owned businesses, a lot of them. And they're struggling to get people. Also, a lot of truck drivers have mothballed their tractor trailer. And they said it's not worth me driving all over, especially with fuel prices right now. We're paying double to get a load of fresh berries in from California that we used to, and same with Florida. Our transportation costs have doubled right now. And when you talk to everybody, they say there's not as many trucks out there on the road. Well, this goes on and on right now, and whatever the reason is, I mean, I don't think people getting paid to stay home right now is helping the price of food, not only food, but a lot of other things. And, I love what the governor and the state of Connecticut have done about offering an incentive to get people back to work. We're excited here at Stu Leonard's about it.
So would some of these business owners be better off paying their employees more to get them to come into work?
Well, of course, everybody would like to do that. But, there's only so much you can pay everybody for working. Otherwise you're not going to make any money. A lot of these small businesses, our farmers, even in Connecticut right now, they're reinvesting. If they get extra money, they're reinvesting in greenhouses and solar energy and being a sustainable farm. And they're struggling with the labor costs right now. A lot of them are paying an extra $3 an hour right now to get more workers, just to get the crops out of the field and the flowers and plants out of the greenhouse. Look, I'm all for more wages. We pay really well at Stu Leonard's. We give great benefits. We have very little turnover here. And I want to take care of our people the best I can. I know they have families, kids. They have a lifestyle that they would like to live. And, to me, something that's very important is to see these young people that maybe even didn't have enough money to go to college. We can bring them into Stu Leonard's and over the years train them and teach them. And, they could be making a lot more than their parents ever made. To me, that's really successful if you can do that. But we're not going to do it if they're not working.
Thanks. And Governor, going back to the Appropriations Committee today, and I can't imagine that you're watching it granularly, but they've added money to the Unemployment Trust Fund. They've established an equity fund, criminal justice components. Is this just all going to be part of the discussions late into the night in Paul's office?
Yeah, I think that's pretty good. Look, there's a lot of commonality. Let's start with that. For me, I think I'd wait and see a little bit on that unemployment trust fund. Let's see what comes out of the next federal act. we borrow money for the unemployment trust fund at a very low rate. Given inflation, they probably almost pay us. But if you want to pour some money in there, you'd have to take it out of education or something else. So there's some trade-offs that have to be made. But basically, I think we're all rowing in the same direction.
And, you know, we've been at this 14 months now. Certainly, Mr. Leonard's employees, Stop and Shop, you name it, all kinds of supermarkets, they've been with us this whole time. They've masked up. You've got a hashtag that says Connecticut Respect. Wouldn't it be a sign of respect to just keep wearing a mask when you go into the supermarket? Is that such a big deal?
Look, I think Stu is handling it right. Let's try it out till Memorial Day, see where people feel comfortable. But Ken, I sort of agree. I understand what you're saying. I think rather than me dictate it, though, I like leaving it up to smart people like Stu Leonard.
Thank you.
The Hartford Current.
Thanks, Max. Yeah, Governor, just one last thing on the bonuses to follow up what Ken was saying. Have you run a calculation, maybe a calculation in your mind, in other words, that this $1,000 is going to do the trick? In other words, you're bucking up against an extra $300 a week, correct? So 4 weeks they would have $1,200 versus your $1,000. Obviously, you settled on $1,000. I guess the question is, are you predicting that will be successful?
I think so, Chris. Look, there are a lot of jobs out there. I think that $1,000 give people a little more of an incentive, makes it a little easier for them to get back to work, a little easier to pay for childcare, whatever those issues might be. You know, Stu needs these people. Manufacturing needs these people. My job is to do everything I can to make it easier for people, A, to get vaccinated so they feel safe going back to work, and then make it worth their while. And, you know, on a personal note, when it comes to food service workers and the such, we determined or learned, or didn't need to learn, they are essential workers. So the fact they're all earning a little bit more money now than they were a year ago is fine by me.
And also, do you have any advice as we're going forward? Obviously, a lot of more people are going to be taking off their masks. What do you say to people who, for example, might be immunocompromised or people who are between the first and second shot, et cetera, et cetera, et cetera? They might not be comfortable with so many people taking off their masks.
I think the CDC got it right, which is COVID really doesn't spread outside, so there's a lot less need to worry about wearing the mask there, unless you're in a kind of congested area. And if you're immunocompromised, for sure, in that area, you ought to be wearing the mask. You know, similar in terms of some of the indoor calculations.
Okay, thank you.
All right, I think I'm getting the signal here. First of all, Stu, thank you, man. Thanks for coming on, and I appreciate your insights into how somebody who runs a successful store thinks about their customers, thinks about their team members, and how we weigh the calculations on that. I just want to say it's been a year. It was March 10th, 2020 that we had our first business restrictions. They were pretty limited. You know, you couldn't have crowds of 250. But it was May 20th, soon thereafter, that we started reopening. And we've been reopening carefully. Back then, it was just outdoor dining with a mask. It was, you know, non-essential businesses could then open at 50% capacity. I don't know if you can remember, that's where we were a year ago. We've been gradually reopening, I think with some success, Connecticut, thanks to you. And now that we have a vast majority of our people of adult age vaccinated, we know we can get back. We know that these business restrictions can end. We know that on Wednesday, it's drinks on us. If you go out and get yourself vaccinated, you get a free drink going forward. We know that we can do it outdoors safely without the mask, indoors safely without the mask, unless you haven't been vaccinated. That's the one group I'm really urging, doing everything I can. Maybe this gives you the extra incentive and push to get vaccinated. Opportunity to get that good job gives you one more reason to go out there and get vaccinated. But what a year it's been. Thanks, everybody. Nice to see you, Stu.